of the other ways our system is broken is our healthcare model. And we have a commodified healthcare system that leads to a lot of pain and suffering in this country. We're definitely experiencing it right now in the middle of this pandemic. And here to kind of break down what's happening is Mark Dudzic. Mark Dudzic is the national organizer and chairman of the United States Labor Party, as well as a labor activist. He's also the national coordinator for the Labor Campaign for Single Payer, which advocates for a single payer healthcare system. Mark, thank you so much for joining us.
Oh, it's great to be here. I just want to give you a quick correction. We kind of put the Labor Party on the shelf about 13 years ago, so can't really say that I'm the current national organizer of the Labor Party.
Okay, sorry, I got an outdated biography for you. But, thank you for taking the time to talk to us today about Medicare for All and what we can do moving forward strategically in order to accomplish it. I'll start off with my first question. In a piece that you wrote for Jacobin, you write about the Democratic Party's platform and how it rejected a top priority for progressives, which is Medicare for All. You write that the draft Democratic platform fails to rise to this historic moment. The draft platform was overwhelmingly approved by the platform committee, which rejected an amendment to add Medicare for All. All 4 national union presidents on the platform committee, including the presidents of 3 unions that had endorsed Medicare for All, voted against the amendment. You also write that it's important for the future strategic orientation of Medicare for All movement, of the Medicare for All movement, to reflect on why it's so hard to win even a symbolic concession on the issue from the Democratic establishment. So my question to you, Mark, is why is it that the Democratic Party is essentially able to give the middle finger to a single-payer healthcare system at a time when the majority of Americans overall, I believe it's about 69% of Americans in a new poll, are in favor of a single-payer healthcare system? Why is it that they feel emboldened enough to ignore a policy that the majority of Americans are in favor of?
Well, I mean, I guess the short answer is that the Democratic Party was captured by neoliberalism sometime around 35 or 40 years ago, that there's been a number of insurgencies within the Democratic Party to try to move it in a more social democratic direction. And we lost the latest battle to do so. And that Medicare for All is really the wedge issue between these two programs, and that's, I think, why they fight so hard. They fought really hard in 2016 on the platform committee, and if you remember, the Democratic candidate in 2016 went around the country saying, "We will never ever have Medicare for All. It's just a bridge too far. It will never ever happen." And again in 2020, this was the issue that they chose to draw the line on, and it's it has both symbolic and practical impact. This was a message to the funders and the neoliberal supporters of the Democratic Party that nothing fundamental will change under a Biden administration.
And what does the platform talk about in terms of healthcare? Like, does it have anything in there that would improve healthcare in the United States?
Yeah, it's a 10-page platform, and there are a bunch of good ideas about how to improve healthcare, expanding rural and urban healthcare clinics, making sure that there's full coverage for all aspects of reproductive healthcare, including access to abortion, LGBTQ healthcare, fully funding the Indian health service, which is desperately underfunded. There's a number of proposals there. It also has a fairly good proposal on how to kind of rein in big pharma with negotiating authority with some teeth in it. But it fundamentally relies on this idea that you can transform this healthcare system by using a public option to provide universal access to healthcare, and it's just a failed idea. It's not going to work.
So let's talk about the public option, because it was sold to the American people as a way of giving people more choices, right? Medicare for All is awful because people wouldn't have a choice. Now, of course, there was a lot of deception there, a lot of anti-Medicare for All propaganda. I think that the majority of Americans who were just laid off because of the pandemic, tens of millions of them, now know that they have no choice because their health insurance is tied to their employer. But what would the public option do, and why do you feel that it is inadequate?
Well, first of all, it treats healthcare, continues to treat healthcare as if it was a commodity rather than as a public good. And that's really fundamental to how you view healthcare and how you should view healthcare policy. If you have commodified healthcare and people are consuming it as consumers and choosing products, competing products, then you have this crazy system that we have that's based on profit taking, and it's incredibly inefficient, and it generates inequality at all levels of the system. So it doesn't work to provide health care to everyone. We believe that a public healthcare system, publicly financed healthcare system with universal access, really is the only way to really improve the choice that people have for healthcare, that they can then choose their own healthcare providers and choose whatever services that they feel that they need to get healthcare. The current system actually restricts people's choice to healthcare by forcing them to choose a narrow healthcare plan. So it just doesn't work. The public option just adds another layer of complexity to the system, doesn't bend the cost curve. In fact, if you're really serious about universal affordable coverage, it's going to radically increase the cost of the system. And we don't have to do that. We can save 20 to 30% of the current cost with better benefits and cover more people from the cradle to the grave in a Medicare for All system. This is not rocket science. Every other industrialized country in the world has figured this out.
So I also have an issue with trusting the Democratic establishment in regard to even fighting for a public option. And I wanted to get your thoughts on that. Now, assuming that it's something that they genuinely want, do you really see the Biden administration fighting for a public option to improve the Affordable Care Act?
Yeah, well, again, this is the problem that we constantly encounter in the political sphere is we start out by bargaining against ourselves. There's this idea that, okay, well, we're not going to be able to win single payer, so let's ask for this, and maybe we can get that. And by the time you do that, you empower the other side to just crush you. So by starting out with your what you think you can get, you're going to end up getting next to nothing. And that's time and time again, the Democratic Party and the supporters within the labor movement who hitch their wagon to the Democratic Party. This is the failed strategy that we constantly get trapped in. We wouldn't do that at the bargaining table. I don't understand why we do it when we do our politics. So already, I've been hearing rumors that there's been signaling that the public option is negotiable and might go away if we win something else. So already it's being further bargained down, and that was the experience in the Affordable Care Act. It was the experience in the mid-1990s with the Clinton health care plan. History just keeps repeating itself.
And as leftists, we understand that the labor movement is central to any sort of meaningful reform of the system. But I'm remembering in the days before the Nevada caucus, where the leadership of the Nevada Culinary Union really dinged Bernie for Medicare for All, saying that it would threaten their Union One healthcare plans. What do you say about that?
Yeah, well, I think we're in this moment when, you know, the system is in such an advanced stage of crisis that it's becoming increasingly difficult to sort of cling to the benefits of the old system. And so, I mean, the Nevada caucuses were really an eye-opener, I think, for the labor movement. The Hotel Workers Union, Casino Workers Union in Nevada, the culinary, as they call it, you know, is a damn good union. It's fought hard battles to, you know, build a powerful contract for marginalized workers who would be, you know, earning poverty level wages, if not for the fights that that union has taken up time and time again over a couple of generations now. So it's a good union with a very active and supportive membership. And they came in hard saying, you know, you're going to lose this plan that took us decades to build. It's a great healthcare plan. And yet, when they counted the votes, the casino workers, the members of the culinary, voted for Bernie Sanders in the majority. And they voted for Bernie because he supported Medicare for All. And these workers, and I think it's because that union has done such a good job organizing and mobilizing them, these workers understand that they're not just union members at a particular casino, but they're part of a working class, and that they need to fight for healthcare for the entire working class, for their family and their neighbors and other workers in their city. And they understand also how precarious that their healthcare benefits are. And in fact, you know, almost immediately after the caucuses in Nevada, you know, the whole country shut down. 90% of hospitality workers have been laid off. And the healthcare plans that the union has fought so hard to establish are now in crisis, and, you know, are probably going to have to start cutting benefits and cutting people off who've been laid off now for several months.
Mark, in a minute, I want to get to what we can do moving forward to strategically accomplish a single-payer healthcare system. But one of the things that I'm so confused about is why in this moment we don't have progressive lawmakers who have said they're supportive of Medicare for All, really taking advantage of the uniquely awful situation we're in with this pandemic to fight and push for Medicare for All. I feel like there's really been silence on this policy ever since Biden became the presumptive Democratic nominee. And so, you know, obviously I'm asking you to speculate a bit here, but why do you think that is? And do you think that this is, you know, a smart strategic move considering Trump's in office and we're trying to get him out? Or do you think that this is really a missed opportunity?
You know, I would say, first of all, that they've not been completely silenced. There was an effort to vote against the Democratic program platform precisely around this issue of Medicare for All, and people like Ro Khanna, you know, publicly said that they were going to vote against the program. Now, they never actually announced the final vote count on that, but, you know, it's my understanding that 700 to 800 delegates to the Democratic convention probably voted against the program because of its exclusion of Medicare for All as the path forward. So, you know, there still is a subdued movement there. But, you know, look, you know, Trump happened, and, you know, we're in this moment of real, you know, kind of existential crisis here. You know, the calculation of many of these politicians has been that, you know, we've just got to, you know, step aside and work to elect Biden and defeat Trump. And so, you know, I wish people understood ways to walk and chew gum at the same time to, you know, support the defeat of Trump, worked for his defeat, but also continue to fight for Medicare for All. But that, you know, is not, you know, the strong point of the sort of progressive side of the Democratic Party. So, you know, that's the reality. Until we have, you know, a real working class political party in this country. You know, we have the political field of play is very limited, and you know, particularly in these do or die electoral moments.
To expand on that, you know, now that Bernie's campaign has ended and it feels very bleak, what's the strategy going forward? I mean, you said like as you say that it seems like right now the political parameters have been very limited. How do we expand them? How do we get more people involved in the labor movement? How do we expand the power of unions? Like what comes next?
Yeah, well, you know, you have to remember that an election comes, an election goes, and you know, they kind of can be seen as a way to assess the respective strength of various social movements and other phenomena, but they don't themselves necessarily build the power that we need to make the changes that are necessary. And so, you know, this is a moment when we ought to really be thinking about what we need to do to build power, to engage, to prepare for the fights going forward. You know, my personal opinion is we've got to get rid of Trump, and the only pathway forward from that moves through the election of a Biden administration. I think we can try to engage as much as we can in electing, you know, strong Medicare for All supporters to Congress and other political positions, and we can use that election campaign to do that. And the other thing I think that's really people can be very responsive to is linking this fight to the crisis that we're all in right now. You know, 1 million workers a week are losing their jobs and will continue to lose their jobs. Those who have lost their jobs a month or two ago are beginning to lose their health care. You know, we need to incorporate a really robust emergency health care benefit for people to make our way through this economic crisis and make our way to the other end of this pandemic. And, you know, that should be based on a public goods model, a social insurance model like Medicare for All. There's a bill pending in both houses called the Healthcare Emergency Guarantee Act. Sanders is the principal sponsor in the Senate, Jayapal in the House. You know, this is a bill we ought to be talking about and talking to our congressional representatives about. You know, the Senate went home without doing any emergency relief extension for working people. We're all going to be back in town in a couple of weeks, and the emergency is going to continue to play out. People are getting desperate, and that's where I think that's where the fight is moving into the election.
Well, Mark, don't worry. Democrats are working hard to expand COBRA, unaffordable health care, if people have been laid off. I mean, it is devastating to see these two parties and see just the lack of representation for the best interests of Americans, for their own electorate. And I want to leave the interview with a powerful part in your piece, which again was published in Jacobin. You write, labor must be central to this movement, and part of our challenge is to work to extract union officials from their instrumental relationships with the Democratic Party. Likewise, the movements for racial justice must contend with a Black political and managerial class that has made its own peace with neoliberalism. Any final thoughts before we go?
Well, I think I said it all in that summary there. I think that's really our challenge going forward. That's the labor campaign really works to move the labor movement into this fight. And you know, I have to say, I think that the conditions have changed so much that you know, once this election is over, because it really taints how people view this, you know, we can really move forward. There was a big fight, for example, at the American Federation of Teachers convention last month about whether the union should hitch its horses to the Medicare for All fight or have a more generic fight. And the only real argument against going all out for Medicare for All that was made was that it would be out of sync with the Biden campaign, and you know, could perhaps provide succor to the Trump campaign. And so, you know, when that is over, there's no other reason left to do nothing other than fight for Medicare for all.
All right, Mark, again, thank you so much for taking the time to have this conversation with us. We appreciate it.
Great to be here. Thanks. Bye-bye.
Bye.